right, so we're very honored to host Dr. Roneil Malkani to talk with us about some of the sleep challenges and strategies that people with neurological conditions might face. And so Dr. Malkani is an associate professor and sleep specialist at Northwestern University and Jesse Brown VA Medical Center, and his expertise lies in understanding and treating sleep and circadian rhythm disorders in people with neurodegenerative diseases like Alzheimer's and Parkinson's, REM sleep behavior disorder, and restless leg syndrome. And Dr. Malkani also serves on several national committees for the American Academy of Neurology and the American Academy of Sleep Medicine. So we're very lucky to have you here, Dr. Malkani. Thanks so much for joining us. And let's get started. So for the first question, could you define for us sleep medicine and just tell us a little bit about how you came into that specific field and share a little bit about your research?
Sure. And thank you for having me. Very excited to be here. Always love doing events with you guys so that I can spread the word and reach out to people and see if there's any way I can be helpful here. So as far as sleep medicine, what is sleep medicine? I mean, we think of just related to sleep, but it goes beyond that. So, generally sleep medicine also encompasses a world not just of sleep problems, but also circadian rhythm problems because they go hand in hand. And this can include problems with disrupted sleep, insomnia, daytime sleepiness, issues with moving around during sleep or behaviors in sleep, such as acting out dreams or other problems, sleepwalking, restless leg syndrome, sleep apnea. So anything regarding sleep, but how sleep influences how we function during the day and how our body functions during the day. And so the reason why this is so important is because sleep and circadian rhythms, we think about for the brain feeling refreshed, but it goes way beyond that. It's for the whole body. It's for our metabolism, our immune function, our ability for energy and exercise, our breathing, so many things. And in turn, all of these things in our body influence our sleep. So it's this complex interplay between our body and our brain, and sleep is a central component to all of this. That if we're supposed to be spending a third of our day sleeping, then it's got to be doing something really important for us, right? And sleep is an interdisciplinary field that is made up of neurologists, but also internists, pulmonologists, psychiatrists, ENT specialists, dentists, technologists, psychologists. It's a team approach here. So for those who may have seen a sleep doctor before, maybe it was a neurologist, maybe it was a pulmonologist or someone else. There are many roads because there's many facets to sleep medicine. How I got into it, in medical school, and this is a big problem in medical school training, we got very, very little of sleep education. Despite its importance, it just isn't something that is very well taught in medical schools. But I spent an internship after medical school working with a genetics expert in Alzheimer's and Parkinson's at NIH. And there I got introduced to the relationship between sleep and Parkinson's disease, particularly in terms of REM sleep behavior disorder and acting out dreams. And that experience completely shifted, the direction of my career. And that's, since then, I've been, passionate about pursuing, understanding that relationship for not just, to see how we can help sleep problems in people with those diseases, but how we can look at sleep and circadian rhythm problems in how these diseases develop, and maybe even capitalize on that to try and slow down or stave off these problems. It goes much deeper than just how do we improve quality of life. It goes even into can we slow down or stop neurodegenerative diseases, including dementias and Parkinson's. Right now, I mean, for those who have interest in sleep, You may have seen many articles, especially in January when everyone's trying to be healthy now, but lots and lots of sleep articles on the importance of it and how much sleep you should get and things like that. Right now there is a booming interest in sleep in the community, and has been an explosion of sleep research. So this is an exciting time for sleep and circadian medicine because we are making so many new discoveries, much more now than we were even 20 years ago.
That's really exciting, and thank you for giving us that overview. That's very helpful. And somebody asked a good question too, if you could define circadian rhythms, what that means, and I feel like that's a good place to begin since that might come up again as we move through the conversation.
Absolutely. So the term circadian is derived from Latin, circa dia, about a day. And that refers to our body rhythms that go about 24 hours. And when we think about circadian rhythms, most people think about the sleep-wake cycle, and that how our sleep-wake cycle is about 24 hours, and it can adjust itself, which is why when you go across time zones, your body adjusts to the new time zone. But the circadian rhythms also goes beyond just sleep and wake. Yeah, circadian rhythms exist in all tissues of the body. Your heart, your gut, your liver, your kidney, your muscle, everywhere. So circadian rhythms extend across the whole body, and every cell has an internal clock. These are synchronized by a little spot in the brain, the master clock, which coordinates all of these rhythms, including sleep and wake. And so when we talk about circadian rhythms, when we're really focusing on sleep, then we're focusing on the sleep-wake cycle. But in a more broader sense, circadian rhythms goes to the whole body.
Super helpful. Thank you. And so let's go forward talking about what some of the sleep challenges that you most frequently encounter as a physician are, especially with your patients who maybe are already living with a pre-existing neurological condition, and then they're coming to you with help, looking for help with their sleep struggles.
So I think the top two problems that I see, the most common two, are problems with breathing during sleep or sleep apnea and insomnia, whether that is difficulty falling asleep or staying asleep or both. There are many other things, including restless leg syndrome, acting out the dreams during sleep. My clinics focus in on people with Parkinson's disease or at risk for Parkinson's disease, and so that gets lumped in there. That's why I have a number of these patients in my clinics. But the top two are apnea and insomnia. And sometimes they go together. Sometimes the sleep apnea worsens the insomnia, and it can be a challenge to try and address that, because if I want people to breathe during sleep, I also need them to sleep. So, rather than be awake. So it's a matter of determining which one is worsening which, if we need to treat the apnea first or the insomnia first. The next most common one is daytime sleepiness, where people are sleepy during the day, having to take naps, or even if they're trying to avoid naps, they're just dozing off through the day. And that can be from a variety of things. Can be from sleep apnea. It can be from disrupted sleep at night otherwise. It can be from the neurologic disease, including Parkinson's disease or other diseases. So, yeah, and in some cases, the daytime sleepiness or sleep disruption can be from medications related to these for these disorders. So, yeah, the challenges in my clinic, then the patients that I see are, it can be a variety of different sleep problems, but they can stem from a lot of different issues. Yeah, if we're going to focus in for a moment on Parkinson's disease, then I can share a slide I have that briefly summarizes Just give a moment here. I can let go. And sorry, it's not ready. Okay, so I have, yeah, just to share one slide here, that, yeah, as a model for sleep problems in Parkinson's disease, my formatting came off as I'm sharing here. But there is this interplay in the physiology between circadian rhythms and sleep problems and the neurodegenerative process itself, such that not only does changes in the brain impact the sleep and circadian rhythms, but the other way too. On top of that, yeah, so from these things, there's the manifestation of either sleepiness or insomnia. And this is just, two of the problems we see related to this. And yeah, but it's not just a matter of these problems stemming from these two components of the rhythm, sleep, and neurodegenerative process, but other problems that contribute to this. So you have sleep apnea, medications, REM sleep behavior disorder, mood problems often weave into this. For insomnia, having to get up at night to pee, which is common with aging as it is, and even more so in certain neurologic diseases. And motor symptoms for people with Parkinson's disease, having stiffness or tremor, restless leg syndrome, medications, and again, mood. So a lot of different aspects here that contribute to the problem. And it's a matter of trying to understand how each of these exist in a patient and how do we unravel this so that we can help people sleep better and function better. As far as how this affects the neurologic disease itself, sleep affects our energy. Sleep problems affect our energy, our concentration, our alertness, our mood. Um, and we're learning more and more about how sleep problems impact what's actually going on in the brain, including in Alzheimer's disease and Parkinson's disease, especially in the last 5 to 10 years. There's a lot of connection between sleep and things like degeneration, inflammation, trauma, stroke risk, and others. And these work in both directions. What's important about addressing these issues is that helping the sleep may help with the recovery, with resilience, with your day-to-day function. And so, and maybe we have yet to understand whether or not this is possible, but maybe if we can help with sleep and the circadian function, can we influence the progression of these diseases?
That's great. Thank you so much for sharing all of that. And I think that speaks to a lot of the people that are on this call for sure. So are there any misconceptions about sleep that you hear? You were saying how there's an abundance of, new research, new studies, and new interest in sleep. And is there anything that you would like to debunk for us that you've heard from your patients or colleagues in the field?
Yeah, so there are a couple of things that I would bring up here. I mentioned earlier that medical students don't get much training in sleep, and that hasn't changed a whole lot since I was a medical student, a couple decades ago. So, uh, and the medical field has, until more recently, just de-emphasized the importance of sleep. As sleep has been growing as a field, especially physicians, we have to, um, we pride ourselves on being able to keep working and keep working, and we don't have a need for sleep, right? And that's absolutely just not true. And recently, over the last several years, this has shifted. So now the importance of sleep is coming back up to the surface, but we have a long way to go to train our medical students and our residents and our existing physicians on the importance of sleep, how to evaluate the problems, and how to address and when to send patients to a sleep specialist. Um, the another misconception is, and I've, in some of the patient talks and webinars and things like that, one time came up this question about the condition restless leg syndrome, as what is it, a made up condition by a pharmaceutical company to just sell more medication? I can tell you that if anyone has that question now, and that's not true. There's a lot of detail on how this happens, why this happens, what changes are going on in the brain, and so on. So this is, the one of the problems with restless leg syndrome is that the term restless legs sounds almost silly, that it's not really important, when actually it is a big problem, and it affects many, many people. And there's a shift to turn this back to the old name, which is called Willis-Ekbom disease, which actually was discovered first written up in the 1600s. So yeah, the importance of sleep is building now. It's shifted in the last decade or two, and though the sleep field it's really less than 100 years old, so it's still building. Um, and there's the final misconception that I'll address here is that I know many people who say I get only 6 hours of sleep and I feel fine and I don't need more. And um, so there are a handful of people where that is actually true, but by and large, if you're getting 6 hours, you're probably not, you're probably sleepier than you realize. And so, most people who say I only need 6 hours, most of them need more. They just are not either not able to get more than six, or they are choosing not to get more because of social work schedules and things like that. So it's still important to get a good amount of sleep. How much that is, now, everyone's a little bit different. Generally, I recommend 7 to 8 hours, but some people need that eight, some people need nine. And so everyone's a little bit different in exactly how much they need. And so this is why there is not a really strong consensus in our field of how much sleep one needs, because it varies from person to person a little. But it's about what you need that will help you feel refreshed and able to function well for the next day.
Thank you. That's a good overview of a couple top three non-facts so that we can put aside. So another question for you, and I'll just ask you a few more things more broadly, and then we have some more specific audience questions too that we'll want to save time for. But if somebody comes to your clinic with a sleep issue, what's your first steps in how you approach that patient and their concerns, or what would be some questions that you would advise patients coming to a sleep clinic to maybe ask to get the answers that they need?
So the majority of the visit, at least half, is just spent talking to, and getting information. A lot of it depends on what's going on with your sleep. And so that's, I ask about, is there problems with falling asleep or staying asleep? How much sleep do you get? What's the schedule like? Does it vary across the week? Does weekdays, weekends, work schedules? And how do you feel after a good night's sleep, versus a regular night's sleep? I ask about the presence of other symptoms like snoring and restless legs and doing other things in sleep, like acting out dreams and so on. I'll ask information about any existing neurologic diseases and the medications, because that becomes relevant to fine tuning the approach here. Um, Depending on the story, depending on the problem or problems, that will lead us to what the next steps are. For insomnia, it might be focusing more on gathering the sleep diary data. So where we track when one goes to bed, when they wake up, how much they sleep, when they wake up, and how frequently, and for how long in the middle of the night, and so on. Sometimes we use more objective means using a wrist activity monitor that's worn like a watch that tracks whether you're moving or not, and that is used as a proxy for rest and activity or sleep and wake. If there's concern about sleep apnea, and then we might do a sleep study, which sometimes is done at home, some may have to be done in our lab. If there's issues with acting out dreams during sleep, sometimes we have to do the in-lab sleep test, which is what we'll look for that. For patients with restless leg syndrome, it's important to check iron levels in the blood because iron deficiency can worsen that. So the exact approach and what tests are done depends a lot on what the problems are. And let's say there's more than one problem, then we may decide to do both types of evaluations, sleep diaries and sleep study. And maybe we decide to do one or the other. It just depends on the specific scenario. Those are the majority of the tools that we have for the evaluation. When it comes to treatments, then it depends on what the problem is. For patients with sleep apnea, there are a lot of different treatments that we use. Some of you may have heard of CPAP, which is the mask that people use, and there's a lot of different masks out there. There's, some that, everyone thinks about the large ones that cover the nose and mouth, but there's some that just go under the nose and are much smaller and lighter. There's a lot of variations. There's dental devices for sleep apnea. There's many options here, including the surgical treatment that I get asked about a lot now, which that's a discussion I'm not going to include here right now. And for people with restless leg syndrome, there are various medications that we use for that. For insomnia, there's a couple of different arms of treatment. There's a variety of different medications that we use, but there's a large group of non-medication strategies we call cognitive behavioral therapy for insomnia. It's an umbrella term for many techniques that we use to help address insomnia. Insomnia can be wrapped in with a lot of negative thoughts and emotions and frustrations and even behaviors that keep the problem going. And the cognitive behavioral therapy helps to unravel that so that it helps address these negative thoughts and emotions and behaviors and allows people to be able to fall asleep. And that's very, very effective. But it takes a little bit of effort, kind of like physical therapy or an exercise program. Sometimes we need to adjust medications or try medications for daytime sleepiness or insomnia. So there's a lot of different things here. It just depends on the specific scenario.
Thank you so much for laying all of that out. That's helpful to hear all of the different kind of interventions and strategies that are available. And I think so if somebody is having issues at home, would you recommend that they start with doing like a sleep diary or something like that to prepare for an appointment potentially with a sleep medicine doctor? Or what else could they do at home?
So if the problem is of insomnia or difficulty falling asleep or staying asleep, a sleep diary is absolutely helpful. And you can do this in a few different ways. For those who are already having some sort of activity tracker, on the wrist, there's a lot of different varieties now, then getting an output of that can be helpful. For those who want to keep a manual sleep diary, which only takes about a minute or two a day, there's a few different ones online. Personally, I like to use the one from the American Academy of Sleep Medicine, where you have to shade in the times you're asleep. It helps give more graphical image rather than writing down times, because it's hard to make out patterns if you're looking at a whole page full of numbers. But there's a few different ones out there that you can see online. Some sleep clinics in advance of the appointment you may send an intake packet either in the mail or online for patients to fill out, and sometimes that includes a sleep diary or other questionnaires. For those who have insomnia and want to start doing something about it, before the appointment. A few basic things that, I always recommend, even though many of the times patients are already doing this by the time they come and see us, is make sure there's not too much caffeine before bedtime, alcohol before bedtime, things that most patients are already, mostly doing. But other things, keeping a regular schedule, having a regular bedtime and wake time, plus or minus an hour. So it's not like you're doing, one night going to bed, waking up at 6 a.m., another night 10 a.m., and so on. Having a regular time, keeping that for a while can help regulate the sleep wake cycle. Getting exercise regularly. And that could be for some, I don't have a strong preference whether you're doing yoga, tai chi, some, cardio, weights, what, yeah, if you can weave in different aspects, that's great. Weight training is also great, but just move, get going, because regular activity is very important for not just the body, but also for regulating the sleep wake cycle and the circadian rhythm. Also, getting light during the day. That's part of our daily rhythm. Light helps regulate our sleep and wake cycle. And we are indoors a lot, especially for those who are in the Chicago area, and it's, minus 30 with the wind chill, not going out. But if you're, getting light can be a challenge in certain parts of the world. But even then, trying to get some light, there's light boxes and so on as well. Light exposure is so important. And the last thing I'll mention, and this has been, especially an issue for the last, 10 years, but especially the last 3 or 4, using the devices at night with, smartphones and tablets and laptops. The constant being plugged in keeps our brain more active and when we're supposed to be winding down. And on top of that, the backlighting from all of these screens is blue enriched, which is even more activating to the brain. And the light at night from our devices promotes being awake and can disrupt our circadian rhythm. So avoiding these devices at night is also very, very important.
That's a very helpful reminder. I'll be thinking of that tonight when I'm tempted to look at my cell phone. So appreciate
Something
that.
I still am working on myself too.
Yes,
Okay?
it's a work in progress, right? That's good because I think that answers one of our audience questions because I'm going to shift over to questions that folks have submitted. And one of those was, what's the top 3 influences on circadian rhythms? So it sounds like light, exposure, and movement would be a part of that for sure.
Yeah, light is sleep. So light and dark is a big one. Activity and meals. Actually, so getting regular meals through the day. Some people eat a lot, for those who eat a lot at night or wake up and eat at night, that is not as good for the metabolism, but that can also disrupt. Seeing disruption in eating related circadian is not a common feature. So the ones I focus on the most in the clinic are, sleep, light and dark cycle. So the light part of it is getting light during the day. The dark part is avoiding the light when you shouldn't be getting so much light or bright lights anyway. And, getting activity during the day. When I say
That's
avoiding light at night, I
helpful.
don't mean turn all the lights off and walk around in the darkness. Please don't take it that way. It's okay to have room lights, but I mean having like bright lights and screens and so on close to the face.
Awesome. So another question for you is if you can describe the difference between different phases of the sleep cycle, so deep sleep, REM sleep, light sleep, and is there one that's most important for proper rest? And is there a way that you can kind of raise a specific, raise the good amount of the sleep stage, or is it better to just let that worry go and try to rest?
So that's a great question. And there's a lot of buzz about getting deep sleep. But yeah, yet the more you read about it, the more confusing it gets as to what is deep sleep exactly. So I'll try to clarify. So there's different stages of sleep, but why don't we start off very general? When we talk about sleep
Oh,
stage,
your audio cut out for a minute, Roneil.
all right, is it okay now?
Hmm.
Yes or no? Okay.
Can you guys hear? For some
Everyone-
reason, I can't hear. That might be
I'm
a
seeing
me
some
problem.
nods. I'm seeing some nods. Okay. So there's two, when you talk about sleep staging, there's two categories. There's REM sleep that it gets a lot of buzz. We call this rapid eye movement sleep, and that's its own stage. And then there's non-REM sleep, which is everything else. And we divide that up into three stages. Stage one, which is very light sleep. People don't generally spend much time there. There's stage two sleep, which is about half of what sleep is. And then there is stage three sleep, which has a couple of other names. One is slow wave sleep, and some people also call that deep sleep. But deep sleep, but some people also call REM sleep deep sleep, and hence the confusion. And so when it comes to the when these occur and the importance of these and so on. So sleep goes through cycles. Each cycle is roughly 60 to 90 minutes. And each cycle is made up of some non-REM sleep, which usually ends in slow wave sleep or stage three sleep, followed by a little bit of REM sleep. And as the cycles go, it shifts where you get a little bit less non-REM sleep and more REM sleep. So this means that in terms of that slow wave sleep, that occurs more at the beginning of the night and gets less and less across each cycle. And REM sleep gets more and more across each cycle. When we talk about what's the function of these? Why do we care about these two, slow wave sleep and REM sleep? Slow wave sleep is a marker of our sleep drive. If you were to stay up all night and then you went to sleep, the first thing you're gonna get is a big long stretch of slow wave sleep. It's absolutely critical for our body to get that. And lots of things are happening during sleep. Sleep isn't just a period of rest. There's a lot of activity in the brain, including hormone secretion and synaptic changes in the brain. Lots of things happening. It's actually a very dynamic process. But slow wave sleep has also been linked to memory function, particularly, being able to remember facts or events. So slow wave sleep is important for your sleep drive, for your for learning and memory, more so with memory and recall. And it's one of the first things you get. And so if for those who have activity trackers and looked at some of the sleep, some of that deep sleep you see early on in the night in that first hour, a couple of hours, most of that is slow wave sleep. Then REM sleep is still a little mysterious. It seems to be more important for procedural memory, maybe emotional memory. That's where we have our dreams. But it still has been a bit of a challenge to understand as well as slow wave sleep. If one wakes up right out of REM sleep, people tend to feel a little bit more tired, harder getting out of bed. If you haven't really been able to complete that cycle. The reason is that REM sleep, the drive to stay in REM sleep actually builds during the night. So it's actually your brain wants to stay in REM sleep, especially later on. The other thing is that part of REM sleep is muscle atonia. What does that mean? Where your body gets kind of paralyzed during REM sleep. That's a normal thing to keep our bodies from acting out the dreams that we're having. Some people have problems with that and actually act out their dreams. And that is a condition that we see in our clinic. But most people, their bodies are paralyzed during REM sleep. And so when you wake up out of REM, your body's still trying to come out of that paralysis a little bit. So you can feel a little bit more sluggish as well. But it's that because REM sleep comes in that last more so in that last hour or two of sleep, it's, people come out of it and they feel more fresh. They feel they've had more dreams. They feel more refreshed for some reason out of that. And so that seems to be another marker of sleep drive. Um, Now, let me get to the question about, should I worry about this? What do I need to do to get more of one or the other? Um, I would say number one, don't worry so much about this. Number two is just focus on getting sleep, because your brain will get the slow wave sleep. If you just get to sleep, your brain's going to get slow waves. For REM sleep, if you are having a lot of disrupted sleep, or you're not getting, you're not able to stay asleep, maybe you're not getting as much REM sleep, but I'm more concerned about just not sleeping at all. And so, but if you can get a decent amount of sleep, you're probably getting REM sleep because your brain is normally going through these cycles. So focus more on just sleep and less on, this deep sleep. Please keep in mind that when people use activity trackers to tell them how much deep sleep they're getting, these are algorithms that are based on degree of movement primarily, because the sensor is an accelerometer. It's a movement sensor. So, and because movement tends to go down both in slow wave sleep and REM sleep, it counts both as deep sleep, so it doesn't really separate it. But it's still a proxy. It's not really measuring, these things directly. And so it can be difficult to extrapolate, am I really getting that amount? And I've seen cases where patients say, I forgot, my activity tracker is saying I hardly get any REM sleep at all. But the person actually had a sleep study too, and they're getting normal amount of REM sleep with normal cycles and everything. These things are not perfect. What I find activity trackers useful for are to help you keep track of whether or not you're keeping your sleep regular and following changes over time. They can also underestimate how much sleep you're actually getting. So I'm more concerned about somebody's experience of how much sleep they're getting and how refreshed they are than I am about with the exact number that the activity tracker says. But the tracker is helpful to see if things changed and in what way.
Thank you so much. I feel like that touched on a lot of topics that are definitely in circulation, like you had said earlier about, especially at this time of year with getting sleep hygiene and all of that. So, another question for you. I know we're getting close to our end time, so I'll keep it moving, but, one of the questions that came from an MSA patient was about how the more relaxed their body is, the more magnified their symptoms are, like tremors and brain zaps, and that makes sleep even more challenging than it already is. And they were asking, is this typical and is this treatable?
So for tremors, tremors tend to come out at rest. For in Parkinson's disease, one of the hallmark symptoms is resting tremor, though not everybody with Parkinson's has that. So, when one is more relaxed and not paying attention, the tremor may come out more. And sometimes that having more tremor can, worsen, it can worsen anxiety or make sleep more difficult and other things. So if the issue is that there is more, say, Parkinson's symptoms, for example, more broadly speaking, at night, whether that's at the beginning of the night or in the middle of the night when waking up, or with just more stiffness and difficulty turning in bed, and that wakes one up. Then addressing the Parkinson's symptoms at night is sometimes helpful. And sometimes that means tweaking the Parkinson's medication so that those symptoms do not interfere with sleep. So it is treatable, but it also depends on some of the nuances for a particular person. But if it's, yeah, again, if it's more emergence of the Parkinson symptoms, then addressing that more directly can be helpful.
Thank you. And then we'll wrap up with one more question. There's other questions out there for you, but we'll just have to save those for another day. And maybe Dr. Malkani, we can send you some too if you happen to have a chance to address them off the meeting here. But so we have a few different questions about different what you would recommend in terms of either sleep aids, like certain sleep medications, or is like white noise something that you recommend for people to relax if people are, you know, used to doing something else that's not reading before bed? What's something they can use, or a device that might be better than some of the other ones that you've mentioned are a little more disruptive to sleep? So I guess we can close with a general, are there any like specific items or activities that you would recommend doing prior to trying to get some good rest?
So prior to sleep, I recommend having some wind down time. This can, yeah, this is the relaxation time where you're priming your brain to be able to go to sleep. And everyone's a little bit different what helps them wind down. For those who have a lot more worries and anxiety, sometimes logging that, doing a worry journal, for example, getting it out on paper, getting it out of your mind is helpful. And then when you go to bed and those thoughts pop up again, then you can say, I already worried about this. I don't need to do it again now. Um, Other things, meditation can be very helpful. It helps shift the balance of, you know, the systems in the body, the fight or flight system versus the relaxation system. It boosts that relaxation system, the parasympathetic system, to prime for sleep. So meditation and mindfulness, I'm huge proponents for. For some, that could be even just some mild stretching because that can be quiet, soft, and can also relax the body a little bit. As far as then right at bedtime, medications and devices and things like that. Medications, you know, the over-the-counter stuff, I can't say I'm a big fan of. Most of the over-the-counter sleep aids, um, you know, can actually linger in the body, can make people feel more tired and groggy in the morning, and over time, actually tend to lose their effect and can be more disruptive. And if you try stopping it, it can make sleep even worse. So I'm not a big fan of these over-the-counter sleep aids. Melatonin itself, generally speaking, is not a great sleep aid, but it has its role. And so for some people, melatonin can be helpful, especially in Parkinson's, but it's more helpful in those who, act out the dreams during sleep, or to help adjust the internal clock earlier and sometimes later in certain instances. But the timing and the dosing is very important. The timing to shift the internal clock, the dosing is much lower. The timing is varies from person to person. So that's something that you need to figure out. It's not just take it at bedtime. As far as devices go, white noise I think is very helpful to help drown out other noises. And so if there's a lot of other background noise, noises in the house, noises from outside, white noise can help dampen that. It doesn't have to be white noise. It could be pink noise, brown noise. There's lots of different colors of noise depending on the distribution of the sounds. But having some sort of like steady sound like that, or water sounds, things like that. Other things, if you want to just use something to help you get to sleep, or you feel like you need to be kind of engaged because you're still used to using the phone, but you don't want the light exposure, listening to an audiobook or a podcast kind of thing can be a good way to not have the light exposure, but kind of just listen to something as you're drifting off to sleep. You can even put the smartphones on a timer so it stops playing after a certain amount of time. so that it stops after you've fallen asleep, and it doesn't disrupt you later. Um, but and you can do the same thing with some of these other noise machines. There's no one particular thing that's been tested for sleep in terms of which noise is best. There's some research in using pink noise for sleep specifically and boosting memory. That's part of what my research involves. But those are very specifically time noises and not just like a noise machine. So if you're going to get a noise machine, that's helpful just to get, um, to help to limit external noises from bothering. Other things that if you don't like the white noise, earplugs can be helpful to reduce that. If you feel like there's light that comes in, either because it's summertime and the light's coming in at 5 in the morning and that's not when you want to wake up, or this is especially the case for those who live in the city, the street light is right outside the window and shining in the bedroom. Um, Having blackout shades or wearing an eye mask can be helpful to reduce that disruption.
Well, thank you so much. I feel like this was such an informative discussion, and we covered a lot of ground. Is there anything else that you want to share that you didn't already have an opportunity to touch on?
I think I covered everything I wanted. I tried packing as many tips as I can in the 45 minutes.
You did great. I feel very refreshed already with information, and so I'm like ready to go. I'm like, what time is it? Ready to go to bed already. So I appreciate you coming and sharing your time with us. Thank you so much, Dr. Malkani, and thank you all for joining us for the webinar. And we will make sure to share the recording with everybody who was in attendance and registered as well. And Dr. Malkani, thank you again for your time, and we'll hope to see you back again soon with us.
Pleasure. Thank you for having me.
All right. Thanks so much, everybody. Take care.
Take care, everyone.